Hello everyone, welcome back to part 2. This is chapter 12, Sleep and Rest. I would like to do a quick little review of some questions. So let's look at this question and see if you can determine the answer. If you mark D, you're correct. Now let's look at this question. Is the following statement true or false? If you mark true, you're correct, and please look at the rationale. In your book, it talks about different types of dysphagia, and in my lecture, I touched on it very little, but I want you to look at this. These are the different types, and see if you can determine the answer. If you marked A, you are very correct. Transfer dysphagia. How about this question? Wow. The appearance of older people can be misleading and delay the detection of a malnourished state. Measurements of weight, serum albumin levels, and hemoglobin hematocrit assist in identification of malnutrition. Now let's talk about chapter 12, Sleep and Rest. Can you think of some terms you should know? Why don't I help you out? Make sure you know about insomnia, nocturnal myoclonus, phase advance, restless leg syndrome, sleep apnea, and also sleep latency. Now relating to let's go back to your nocturnal myoclonus. Please look up these in your book. But I do want to make sure that I reinforce that the condition is characterized by at least 5 leg jerks or movements per hour during sleep. Sometimes people get that mixed up and want to diagnose as soon as possible, but look is what entails the nocturnal myoclonus. Now look at the introduction, and I want you to look at each of these bullet points because this is what we're going to focus on. Look at this question. Is the following statement true or false? Kandahite talked about nutrition earlier, about the quantity and quality, right? Same thing goes for here. Quantity and quality of sleep can determine an older adult's health and well-being. Very true. Now here are some bullet points that I want you guys to focus on. Now look at the age-related changes in sleep. Now what are we talking about when we're talking about age-related changes in sleep? What about the circadian sleep-wake cycle? Please review that. And the phase advance, common among adults. Look at the sleep stages. More times, the older adult for the sleep stages is more time in stage 1 and stage 2, and less time in stage 3 and stage 4. Now I want you to go back to your chapter and read what stage 1 and what stage 2 is, so you can focus on that and apply it to your patient in the clinical setting. Remember, they have less sound sleep. So a delay in onset of sleep is what they have. So less sound sleep meaning noise. Remember we talked about noise earlier and how that can awaken them very quickly. Look at sleep disturbances. So common sleep disturbances and causes. Look at insomnia, leg movement, sleep apnea, even medical conditions. What about medications? Yes, medication. So we want to look, sometimes you guys can look up the Pittsburgh Sleep Quality Index. When we talk about insomnia, what are we talking about? Difficulty falling or staying asleep or prematurely waking. Insomnia. Okay, the recognition as a symptom assessment for factors affecting sleep. These are some things. Short-term problems. What about the change in the environment? Remember we talked about the temperature of the room and how it can be cold. What about illnesses, stress? They can't think about going to sleep. They got a lot on their mind. Anxiety. They can't sleep because they're so anxious about something. Let's find out what the underlying cause is. physical or mental illness? What about environmental factors? How about just a strange place? I cannot sleep in this place because it's not my home. Substance abuse, and once again, medications. Now, when we look at nocturnal myoclonus and restless leg syndrome, don't forget about the jerking legs during sleep. Nocturnal myoclonus, remember I said it, should we repeat it? 5 leg jerks of movement per hour during sleep. What about the restless leg syndrome? That's a neurological condition of urge to move the legs. It's associated with what? Iron deficiency anemia, uremia, Parkinson's disease, rheumatoid arthritis, diabetes, and also neurological lesions. Well, last but not least, what about sleep apnea? You know what? It is a significant disorder. 5 episodes of cessation of breathing lasting 10 seconds. We can say these patients or older adults are experiencing sleep apnea. 5 episodes of cessation of breathing lasting 10 seconds. You know what? It can cause disorders in this. When I'm talking about sleep apnea, it can cause disorders in central nervous system affecting your diaphragm. They definitely need to be evaluated at a sleep disorder clinic for best treatment. And then supine position for sleep should be avoided. Supine position for sleep should be avoided. Here we go. I hope you did your reading. Look at this question and see if you can get the answer right. I would play the music for you. There you go. More shifts into stage 1 sleep. Look at that rationale. Reread your chapter. Reread that paragraphs that talk about sleep. Let's talk about medical conditions affecting sleep, drugs that affect sleep, and some other factors affecting sleep. Now, when we talk about medical conditions, what about chronic diseases, cardiovascular, respiratory problems, even diabetes? Let's look at GERD. Have you ever, lying flat in bed, having GERD, it gives a very uncomfortable feeling, burning sensation. Also, musculoskeletal conditions, weakness. What about dementia? Okay, unable to sleep. Mind is just going. Maybe some confusions or up and about in bed throughout the night. And then also depression or emotional problems. Those all are medical conditions that affect sleep. What about some drugs that affect sleep? Now, in your book, there's a list of them. I'll mention a few, but there are a lot more. Anticholinergics, antidepressants, even antihypertensives, benzodiazepines. What about your beta blockers? Did you know that those affect sleep? Diuretics, levodopa, steroids, theophylline, thyroid preparations, caffeine, and alcohol. Those are all drugs that does affect sleep. We do have other factors that we do have other factors that affect sleep, and they are environmental factors like apartment on a busy street, the spouse is snoring, excessive warm room or cold room, the hallway lights are bright. Remember we talked about a nice soft light like red or green. Those are other things that can affect sleep. Now that we know those things that can affect sleep, what about promoting rest and sleep in older adults? How about stress management to promote sleep? And of course, pain control. So when we talk about promoting rest and sleep in older adults, we want to have a really good assessment, make sure the time spent in sleep, naps and quality is the time spent in sleep, it's all quality. You know, we want to make sure as a nurse we review the medications, things that may interfere with the sleep. We want to make sure that we assess their bedtime routines. What is it that they like to do before going to sleep? Maybe reading a book, watching television, or nothing. Just crawl in bed and sleep. And then the presence of sleep disturbance. What is disturbing these individuals from sleeping? Also, don't forget about pharmacological and non-pharmacological therapies. A nice warm back rub. How about stress management to promote sleep? So the interventions would be to respond to stress in a healthy manner, manage lifestyle, make sure they're relaxed. And some older adults like to pray prior to going to sleep. And of course, you know what? We all want pain controlled. So pain interferes with normal sleep pattern for sure. Identifying the cause of pain is an essential for controlling pain. And then make sure we do a comprehensive assessment. Now let's touch on some questions. And this question is going to deal with medications. How do you feel about answering this? Without going to your chapter, do you know this answer? Correct. I knew you knew it. Benadryl. Now let's look at another one. And don't forget to read the rationale. How about this question? Well, let's see. Very good if you got it right. If not, just reinforce yourself in the chapter readings and be more knowledgeable on the information. As I spoke before, I try to keep you under 15 minutes. So please stay tuned for the last chapter, and that will be part 3. Thank you. Take care.